Okay, Dr. Jones, ladies and gentlemen, thank you very much for the opportunity of talking to you today. I appreciate it very much. If you just look at that person next to you, one of you is going to die from atherosclerosis. Now I know it's going to be the other one, not you, but the problem in the Western world, the major disease in the Western world is atherosclerosis. It's going to kill 1/2 of us. The average age of death in men from this condition is 60. The average age of women is 58. Last year, atherosclerosis alone cost $88 billion in the USA alone. Coronary bypass last year cost $18 billion, the single most expensive healthcare item. What I'm going to try to do here is to present 5 questions and try to answer them. Question 1, how much atherosclerosis is present in patients with symptomatic coronary atherosclerosis? The answer to the question really is a lot. It has to do specifically how it's asked. If we take the 4 major coronary arteries, the right, the left main, the left anterior descending, and the left circumflex, that adds up to about 27 centimeters of artery. But the average person with symptoms of myocardial ischemia has 2 of these arteries narrowed greater than 75% in cross-sectional area. That is, if you take a circle divided into 4 quadrants, over 3 of those quadrants are obliterated by atherosclerotic plaque alone. So at least 2 of these arteries are severely narrowed. Now, if one tries to answer this question, how much atherosclerosis is needed to produce symptoms of myocardial ischemia, there is no difference in the person with acute myocardial infarction, the one who makes it into the coronary care unit, compared to the patient with so-called sudden cardiac death who the typical example is the man about 55 watching television and suddenly his head drops. The person with healed myocardial infarction and the person with angina pectoris. All these 4 major manifestations of coronary disease, they have the same numbers of coronary arteries severely narrowed if one looks at it by this 1, 2, 3, 4 vessel disease approach. On the other hand, if you ask the question, how much narrowing is present throughout the coronary arteries, so that we divide them into little bitty 5-millimeter segments, let's say, and ask how many of these segments are narrowed greater than 75%. How many are narrowed 51 to 75%? The answer is quite different. And it turns out in the average person, we have about 55 little 5-millimeter segments of coronary artery to look at. And it turns out that about 1/3 of them are narrowed to this extent, greater than 75% in cross-sectional area. Another 1/3 are narrowed 51 to 75%, which is that extent. And only about 8% are narrowed 25% or less, which means minimally. Thus, the amount of coronary narrowing in a person who develops chest pain, acute myocardial infarction, angina pectoris, or sudden cardiac arrest is extremely extensive. The other thing about this approach...
That's enough. Why don't we look at this?
Okay.